Good morning, class. Today, we will be diving into the fascinating world of radiology as it pertains to rheumatoid arthritis, RA. This chronic autoimmune disease affects millions of individuals worldwide and can have a profound impact on their quality of life. Our focus will be on the role of various imaging techniques in diagnosing, evaluating disease activity, and guiding therapeutic interventions in patients with RA. Let's begin our exploration by looking at the imaging hallmark of RA, which is synovitis, or inflammation of the synovial lining of joints. Magnetic resonance imaging, MRI, allows for excellent visualization of this inflammatory process, enabling radiologists to identify and assess the extent of synovitis. Moving on, RA can cause significant changes in the subchondral bone, which is the bone just beneath the cartilage. These changes, such as erosions and bone marrow edema, can be detected and monitored using various imaging modalities, including X-ray, MRI, and computed tomography, CT. Ultrasound Doppler evaluation provides real-time assessment of the blood flow within the joints affected by RA. This technique allows us to detect synovial neovascularization, which is closely associated with disease activity and can help guide treatment decisions. Positron emission tomography computed tomography, PET-CT, is a powerful imaging tool that combines functional and anatomical information. By utilizing radiotracers, PET-CT can assess the metabolic activity of inflamed joints in RA, aiding in early detection and monitoring of disease activity. RA commonly affects the small joints of the hand and wrist, leading to characteristic deformities. Radiographic imaging, including X-ray and CT, allows us to evaluate and quantify these deformities, providing valuable information for treatment planning and follow-up. While RA predominantly affects peripheral joints, it can also involve the spine. We will explore the imaging techniques utilized to evaluate the involvement of the thoracic and lumbar spine and discuss the implications for patient management. High-resolution peripheral quantitative computed tomography, HRPQ-CT, is a cutting-edge imaging technique that provides detailed information about the microarchitecture of bones. We will delve into how HRPQ-CT aids in the early detection and monitoring of erosions in RA patients. Interventional radiology plays a crucial role in the treatment of RA. We will explore how image-guided procedures, such as joint injections and radiofrequency ablation, can alleviate pain and improve joint function in affected individuals. Certain conditions can mimic RA by causing periarticular soft tissue calcifications. We will discuss various imaging techniques that aid in the differential diagnosis between RA and other pathologies, such as calcific tendinitis or tumoral calcinosis. Articular cartilage damage is a common feature of RA. We will explore how advanced MRI techniques, including T2 mapping and delayed gadolinium-enhanced MRI of cartilage, (GMRIC), can provide quantitative information about cartilage integrity and aid in treatment decisions. Advancements in imaging technology have allowed for the development of quantitative imaging techniques that can assess disease progression in RA. We will discuss methodologies such as volume rendering, texture analysis, and machine learning algorithms, which can provide valuable insights into disease course and response to therapy. Lastly, we will examine how imaging techniques, such as MRI and ultrasound, are utilized to assess treatment response in patients receiving biologic therapies for RA. Monitoring changes in synovitis, erosions, and joint functionality can guide treatment modifications and optimize patient outcomes. In conclusion, radiology plays a crucial role in the diagnosis, evaluation, and management of patients with rheumatoid arthritis. By utilizing various imaging techniques, we can accurately detect disease activity, monitor progression, guide therapeutic interventions, and evaluate treatment response. As future physicians, understanding the role of radiology in RA is essential for providing comprehensive care to our patients. That concludes today's lecture. Thank you for your attention, and I encourage you to ask any questions you may have.